Welcome to the Ian Vodcast Entertainment News, presented by Robin Knipe, Liam Duff, Tiep Tiep, and Christian Omeska. Hello. Thank you for all tuning in to the first episode of the Ian Vodcast. My name is Christian Omeska, and before we begin, I'd just like to advise everyone who may be listening that the following content we're about to present may be distressing for some listeners because today we'll be talking about an issue that has arisen in awareness and evolved in society today. Mental illness. So specifically, we're going to be talking about anxiety today. Anxiety is no joke. It's a delicate issue that we all must care about because it can potentially ruin lives. Here with me to talk about anxiety later in the podcast is Dr. Auler. Anxiety is a mental disorder where the sufferer experiences anxiousness, fear, worry, or stress, perceives situations to be more harmful than they appear to be. This feeling of worry, fear never subsides and makes it hard to negotiate through daily life activities. 3 scales of symptoms include physical scale, psychological scale, behavioral scale. Physical, constant pain attacks, quick breathing, and restlessness. Psychological, excessive fear, worry, and obsessive thinking. Behavioral, avoiding situations that impact daily life. If you experience any of these symptoms, call 13 11 14, the Lifeline helpline. Now here with me to provide more insight is Professor Auler, who is a head professional of mental psychiatric health in Sydney University. Welcome, Professor Auler. With your experience in mental health, you have obviously consulted many people who have suffered from anxiety. What do you regard as the definition of anxiety? Well, Christian, I pretty much agree with how you describe anxiety. It is certainly a mental condition of the human brain, where the sufferer is always anxious, scared in many given situations and scenarios. To further explain this, the reason why I believe they try to avoid these situations as much as possible is because these patterns are seen irregular in the brain, therefore causing the person to trigger in such a way that they want to avoid the situation.
That seems to be very interesting. What causes anxiety? The causes of anxiety are different to every person according to the situation that they're in. The most common external factors that cause anxiety include stress in many areas like work, school, and relationships, emotional trauma, substance abuse, and side effects of medication. The anxiety becomes very prominent when these factors continue to trouble the sufferer for long periods of time. Are there any treatment programs that are available for those who suffer from anxiety? There are a variety of treatment programs to suit your needs, but I believe that the very first port of call is to always speak to anyone who is close to you. Let yourself open up and talk freely, letting your loved ones understand your story and what is going on in your life. Being able to constantly communicate gives you the confidence and belief to continue to talk to more people. If that doesn't help, then you have treatment clinics and organizations such as Beyond Blue. We encourage you to find a treatment program that best suits you. That's all we have time for, Professor Auler. We'd like to thank you for providing us your perspective on anxiety.
Now to focus on anxiety on a large scale. Here are some statistics that will really indicate the enormity of anxiety in Australia. The first statistic is that 14% of Australians will be affected by anxiety at one stage in their life. This equates to around 3 million people. 12% of 13 to 17-year-olds with a mental illness report about contemplating suicide. Finally, women are 18% more likely to seek help for anxiety disorders than men, and only seek help 11% of the time. This is important because I want to stress the importance of speaking about what you feel. That wraps up our first episode of our Good Health podcast. I thank you very much for listening, and I hope we can all take something out of this. If you are suffering anxiety, here are a few phone numbers of a few organizations which you can dial for help or seeking a counselor. You can call Lifeline at 13 11 14 or Mindframe at 492 246 904, or Beyond Blue at 1322 4636. Tune in for our next topic, how much sleep is enough sleep.